Happy Valentine's Day from the Improve Life PLLC team.
In this video, we will be exploring scientific studies investigating the impacts of relationships on healthcare.
We will address platonic, romantic, and professional relationships, including romantic relationships among students, caregiver and patient interactions, and network encouragement in veterans.
Enjoy!
Hi everyone! Today I'll be breaking down an interesting study on how social relationships impact medical treatment, specifically how veterans with PTSD decide to seek care. This study, conducted by Spoon et al. In 2014, explored how veterans' beliefs about treatment and encouragement from their social networks influence their decision to begin mental health care through the VA system. The researchers wanted to answer a key question. Do veterans' personal beliefs about PTSD treatment, encouragement from family and friends, impact their decision to start care? Well, to find out, they studied over 400 VA service users diagnosed with PTSD. These veterans completed surveys measuring their treatment beliefs, social support, and whether they initiated mental health care within a year. The researchers analyzed these factors to see what predicted care initiation. The results were clear. Veterans who believed PTSD treatment was effective more likely to start care. But there was another big factor: social encouragement. Veterans who had friends and family urging them to seek help were significantly more likely to follow through. On the other hand, those with negative treatment beliefs or little support were less likely to engage in care. So what does this mean? This study highlights the power of relationships in healthcare. Encouragement from loved ones can be a game changer in getting veterans the treatment they need. Clinicians should consider involving patients' social networks in the process. However, there are some limitations. The study relied on self-reported data, which can be biased. Plus, it only focused on VA users, meaning the findings might not apply to all veterans. Overall, this research shows how important social support is in medical treatment, especially for mental health. If we want to improve PTSD care, we need to focus not just on treatment itself, but also on the social networks that influence seeking help. Thanks for watching.
Hi guys, my name is Carter Rothhaus, and today I'm going to break down a research study that I read. The study is called Social Relationships in Physicians' Work Moderate the Relationship Between Workload and Well-Being. This was published in a European Journal of Public Health in about 2018 by a guy named Alto and his colleagues. The big idea of the research paper was to study how social relationships at work impact the way that workload affects the well-being of physicians. More specifically, the researchers wanted to understand if strong social support could buffer the negative effects of a heavy workload on a doctor's mental health, as well as their physical health. To answer this question, they conducted a 9-year follow-up study with over 1,500 physicians. They collected data through surveys assessing workload and social relationships with colleagues. This indicates both their well-being and their stress level and job satisfaction, and they also looked at how these factors changed over the 9-year period of time. The studies found that physicians who reported better social connections with colleagues at work have less negative effects from a high workload. This shows that strong workplace friendships and support networks are key to protecting their mental health. For healthcare organizations, creating a supportive and comfortable environment for the workers will enhance job satisfaction and overall well-being. This means that doctors and nurses wouldn't be so exhausted after working long hours throughout the week.
Hi everyone, I'm Bufana Lava, and today I'll be discussing a study that examines how relationships within primary care practices can impact healthcare quality and improvement, a study that was written by Lanham and colleagues and was published in 2009. So this study has a core research question that seeks to answer how relationships within primary care practices can influence the quality of healthcare delivery and practice improvement. So this study analyzed data from 4 large NIH-funded studies and focused on primary care practice improvement. So they used a grounded theory approach and a complex adaptive systems theory, and they looked at data that they collected from direct observation between clinicians and staff, observations of patient-clinician interactions, in-depth interviews, surveys, chart reviews, and more. So the key findings in this study were that there are 7 relationship characteristics that play a key role in successful practice improvement, which are trust, mindfulness, heedfulness, respectful interaction, diversity, social task relatedness, and rich versus lean communication. So yeah, that's pretty much what they found, and the conclusion and applications from this study is that the quality of care is not just about protocols, it's also about relationships, and healthcare teams that foster these 7 characteristics will see better patient outcomes and more effective practice improvements. Thanks, bye-bye.
Hi, so I'm going to be presenting key findings from the study on the longitudinal impact of the physician-patient relationship on functional health. So this research is really important as it explores how ongoing interactions between patients and physicians affect health outcomes over time. So our main question was, how do changes in the physician-patient relationship impact a patient's functional health over a year? So this study was a prospective cohort study using data from the Medical Expenditure Panel Survey, focusing on adults who had consistent office visits over 2 years. It analyzed changes in functional health using the short form survey and related these to variations in the quality of physician-patient relationship. Findings revealed that improvements in the physician-patient relationship correlate with better functional health outcomes. Conversely, a decline in relationship quality was associated with worse functional health, demonstrating the important role of effective communication and trust in healthcare. This study underscores the importance of the physician-patient relationship in maintaining and enhancing patient health. It suggests that healthcare should prioritize patient-centered care to improve health outcomes. And this research can be applied by encouraging health policies and clinical practices to focus on relationship building. However, limitations include potential biases due to self-reported data and the observational nature of this study.
Hi, my name is Shreya, and today I'm going to be discussing the social relationships and physiological determinants of longevity across a human lifespan. So the main research question that was asked was that how do social relationships really impact biological markers of health across different stages of our lives? So the researchers also really wanted to see if having strong connections with others could really impact things like our blood pressure, inflammation levels, and overall health. So they analyzed 4 different age groups such as teens, kids, adults, and older adults, and they measured things like our blood pressure, inflammation levels, and body fat index to see if they had social connections made with the differences in our health. So some of the findings and conclusions from the study was the results really showed that people with more social connections had better healthcare outcomes like lower inflammation levels, healthier blood pressure levels, and also a lower risk of chronic diseases. But however, people on the other hand were also who were more isolated and tended to not have better social relationships, tended to have worse physical health, especially as they got older in their lives. So the study really showed that having strong relationships isn't just good for our mental health, but it can also help our body stay healthier too. And it also suggests that doctors and other healthcare programs should focus on social well-being as being like a part of healthcare. And also, since this was an observational study, it didn't really prove the relationship cause better, like it doesn't really prove a cause and effect relationship. So there should be other factors that could play, like other co-founding variables that might have like a chance of affecting the study like results. So this study could also really show that socially connected is a key part of staying healthy. So having good relationships it's like a really important part in having a better life and staying healthy in general and just building connections with people.
I'm Anvita, and today I'm discussing a study on how media reports and personal connections affect trust in doctors. The study is by Chen et al. 2023 and looks at how negative versus positive media coverage and connection-based medicine influence patients' perceptions of physicians. So for the methodology in this experiment, researchers conducted a vignette experiment with 2 groups. The first group being cancer patients and their families, because they rely heavily on doctor trust, and the second group was general employees, just to represent public perception. So both of these groups read medical scenarios where doctors had positive or negative media coverage and either non-connection-based or connection-based patient relationships. Some key findings in this experiment are that negative media lowers trust in doctors, positive media improves trust and perception of competence, and when outcomes are bad, connection-based doctors lose more trust in others, and people blame connection-based doctors more for failures. So overall, the study shows that media coverage shapes trust in healthcare. Positive media can improve doctor-patient relationships, and while regulating connection-based medicine could ensure fairer healthcare. However, the study was done in China, so the results might not apply everywhere.
Hello, today I'm going to be exploring how relationships impact medical care. I'll be focusing on a study examining older adults' social relationships and how they impact their healthcare utilization. In the study, they measured how the older population, 6 year older, get access to social network, receive social support, and how much of that support they really gain, and how that correlates with their healthcare service utilization. For example, do more isolated older adults have a higher health need due to putting off their care? The researchers analyzed 126 studies from multiple countries, which include longitudinal studies, cross-sectional surveys, and retrospective analysis of healthcare records. The predictors are the social isolation with the lack of social connection, which is measured by frequency of social interaction, whom they live with, and their social network size. and loneliness, measured by surveys and psychological tests on how often they get the feeling of being alone. The outcomes are healthcare utilization, which includes but is not limited to hospital admission and readmission, ED visits, primary care visits, and the use of mental health services. The results show that social isolation is linked to more frequent doctor visits and higher hospitalization rates, but loneliness may lead to delayed care-seeking behaviors, which leads to worse health outcomes. And even though some variation was seen, the overall study says that social relationships play a crucial role in receiving timely and proper care in older adults. More research is needed to explore the correlating factors that come along with older age other than social isolation, which may also be the reason for the decreased healthcare utilization.
Hey, Improve Life LLC. I'm going to be talking about how relationships influence medical treatment as well as physical health. So some people might think that's ridiculous, but multiple studies show that your romantic partner might be influencing your health more than you think. So research shows that relationships have a major impact on both mental and physical well-being. A recent study that found that most people see their partners as positive health influences, especially when it comes to eating habits and exercise, which makes sense because when you're spending time with the person, they can influence those habits. Like, you might not have been a gym rat, but like your partner is, so now that influenced you to go. That doesn't happen to everyone, but it's certainly something that does happen. Interestingly enough, women were more likely than men to feel influenced by their partners. The only thing is that this doesn't happen, like I said, was hinting at earlier, this doesn't happen in all relationships because the quality of the relationship matters. A strong supportive relationship can boost your health, while a stressful or unhealthy or unhappy relationship can do the opposite. Stress from a troubled relationship can lead to serious health issues, while a happy relationship encourages overall well-being, which I feel like makes sense. So after looking into the study done by Charlotte and Markey, her study dives deeper into like how people perceive their partner's impact on health. It examines gender differences, predicting that men and women report more positive than negative influences, but men may feel more impacted overall. The study also explores which areas of health like diet and exercise are most influenced by romantic partners. The study didn't exactly go into what specific asset affects men more deeply, but it just said that it did. After looking more into it, it seems to highlight the fact that in a relationship, the stress factor can be the biggest detriment to someone's health, which makes sense because, I mean, looking at the effects that stress has on people normally, we know it's negative. So if something external is stressing you out, it honestly makes sense.
Hi, my name is Isha Prem, and the study that I decided to present today is romantic relationships and their physical and mental effects on college students. So there was a national survey conducted, and the age group that they conducted the survey on was between 18 to 25, which is the typical college age group. And most of these students do support non-traditional marriage values. About 76% of them actually do see themselves getting married in the future. So this study does explore the health benefits of committed relationships that specifically involved college students that are dating. And it kind of tends to show that there are health benefits of being in a committed relationship as a college student because you are less likely to engage in risky behavior like substance abuse. So this study specifically involved 1,621 students as their pool of people. And it was found that those in committed relationships had a lower BMI, fewer mental health issues, and engaged in less risky behavior like substance abuse and binge drinking. So reduced behaviors such as these harmful behaviors tends to support the fact that committed relationships do support healthier behaviors, but there's no exact link between relationship status and physical health. So this is something that does need to be researched in the future, especially the long-term effects of being in a relationship and the relationship quality on a college student's mental and physical health.
Hi everyone, my name is Laksha, and today I'll be talking about a study done by Benedict T. and Thomas N. in 2022 called Romantic Relationships and Mental Health During COVID-19 Pandemic in Austria, a population-based cross-sectional survey. The study looked at an association specifically between romantic relationships and mental health during times of COVID-19. The research was specifically done in Austria and focused on a population-based cross-sectional survey. The survey focused on mental health for individuals who were present in romantic relationships during the COVID-19 era. Overall, the study determined that the higher the relationship satisfaction, it was related to having a better mental health. Anxiety, depression, and suicidal thoughts were all lowered for individuals in happier relationships compared to those who were just single. Despite this was only related for those who had a higher satisfaction in their relationship. Those who had lower satisfaction were left having more mental health issues such as higher anxiety, depression, etc. As per this finding, this research highlights the effects of romantic relationships helping with mental health and mood, specifically during hard times such as COVID-19. Specifically, the higher satisfaction relationships. For those who are lower, it was harder for them for sure. It is important to look at how truly a relationship is beneficial for someone and versus is not, as it can have different mental health effects on individuals. Thank you.
Hi everyone, my name is Siona, and today I'll be discussing a study titled The Relationship Between Caregiver Impacts and the Unmet Needs of Survivors of Stroke. This study examines the challenges faced by stroke survivors and how it affects their caregivers' well-being and health. The key research question of this study is, how do unmet needs of stroke survivors impact their caregivers? To answer this research question, researchers conducted a cross-sectional survey and used data from the Australian Stroke Survivor and Carer Needs Survey. There are 369 participants in the study, and they were all caregivers of stroke survivors. Most of them were female, and the median age was 64. These caregivers rated how caregiving affected their work, friendships, spousal relationships, and their leisure. And survivors reported on their unmet needs relating to work, finances, daily living, and their health. This study found that the more unmet needs a stroke survivor had, the greater the negative impact on their caregiver. And some applications of this study are that they could implement healthcare policies that give and provide resources to long-term caregivers that help prevent burnout and other negative effects from caregiving. So some limitations of the study are that it is a cross-sectional study, meaning that it doesn't really specifically look at the long-term effects of caregiving, and it's just focused on one specific time period. And also another implication is that this data is self-reported through a survey, so there could be some personal bias or some things that aren't 100% accurate. Overall, this study shows that when stroke survivor needs are unmet, caregivers actually suffer as well.
My research question was, do older individuals face inequities in the healthcare system, and do they receive a different level of treatment than younger individuals? This was a literature review of studies done with the intent to determine whether recent research practices show any significant results. In order for a study to have been considered eligible, they had to have been in a country within the Organization of Economic Cooperations and Development. They had to focus on age-related patterns of healthcare receipt, and they also had to involve patients 60 years or older. 49 out of 456 papers were eligible for the study, and while there were confounding results, there were 36 papers that reported that younger individuals were more likely to receive help as opposed to older individuals. Although there was a majority in the findings that supported the research question, there were a plethora of other factors that could have contributed to the results. As a conclusion, we as individuals and healthcare workers should not be so fast to jump to the conclusion of ageism when there is an inequity. Due to the limited amount of sources and evidence, it is impossible to say that age is a leading factor as to why older individuals may be experiencing less or poorer healthcare as opposed to younger individuals. In the future, we can shift our healthcare options to make them meet the needs of our patients better. These could be different methods of accessing care or more research into how equity concerns the development of inventions and treatment.
My research study was called Lovesick: Mental Health and Romantic Relationships Among College Students, and was researched by Lacey Ritter, Taylor Hillard, and David Knox. The research question was how self-reported mental health diagnosis influenced the ending of romantic relationships in undergrad college students. The study consisted of 267 undergraduate students from a small school. The students were asked questions on a 43-item self-reported survey. The survey asked about mental health, relationships, gender, and sexuality. Some key findings from the study also include that almost 70% of women and 50% of men reported a clinical or self-perceived mental illness. White straight men preferred a partner without a mental illness due to stigma, and minority groups were more accepting of mental illnesses. Being in a relationship did not tend to affect the students' perceived mental health, and men were more likely to blame their partners for mental health affecting their relationship. Overall, the study concluded that there were no significant gender, race, or sexual orientation differences in the likelihood of a relationship ending due to mental illness. Some applications and implications from the study include universities providing more access to mental health care, including counseling and stigma reduction efforts. The study's limitations included sample bias. because there were more females than males and more white people who filled out the study, and it being a self-reported data study. The study was also a cross-sectional study, meaning that it only measured data from a specific point in time and not longitudinally. In the future, the researchers wish to research a larger sample group and make the study longitudinal.